Afternoon. Stephen, Joyce. So good afternoon, everyone. Joined again today by Dr Veach, Catherine Morgan-Wicks and Dr McEwen's with us as well, as he was on over the weekend and obviously spoke to you on Saturday as well if there are any matters that we need to refer back to. Now obviously in terms of the evolving situation in Queensland today have reported another 13 community cases of COVID-19, and as a result the state's lockdown for the 11 LGAs has been extended until 4 p.m. on Sunday. This has been done to give authorities a fighting chance of getting on top of the Delta outbreak, which obviously remains very serious. Here in Tasmania, on Saturday we responded swiftly and we classified those 11 South East Queensland local government areas as high risk level 2. This means that anyone from those 11 impacted areas are no longer able to travel to Tasmania unless they are approved to travel as an essential traveller or specified person. We've also required that anyone in Tasmania who's been in these regions on or since the 17th of July immediately go home or back to their accommodation with their movements restricted by stay-at-home directions. Now I understand that this is an inconvenience, but I want to stress that this is a very serious situation. As I said on Saturday, this is not a drill. The Delta variant is a whole new ballgame, and we ask all Tasmanians to do the right thing to protect themselves, their loved ones and their community. Now, Public Health has further reviewed the situation and, given the extended lockdown in Queensland, has provided updated advice to the government. Tasmania will continue to mirror the restrictions put in place within Queensland, meaning our high-risk level 2 declaration and stay-at-home directions will remain in effect until at least 4 p.m. on Sunday the 8th of August, with a review to be undertaken later this week. Now, those people in Tasmania who are currently subject to the stay-at-home direction, because you've returned from Queensland and been in one of those 11 high-risk area LGAs, you must follow the requirements of the direction for 14 days after you were last in South East Queensland, and importantly, you must have received a negative result from a COVID test done at least 12 days after leaving South East Queensland to leave the stay-at-home order. Now, this process will continue on a rolling basis for all people who have returned to Tasmania from South East Queensland's high-risk areas since the 17th of July. You should book a test on or after day 12 after you left the affected South East Queensland high-risk area, so that after day 14 and with a negative test you can resume your normal movements and activities. We will be SMSing people, those that are at the 12-day period in terms of their test. Now, I would make the point that we've already been in touch with those people that would have left Queensland on the 17th or the 18th, 19th, I think through to the 21st, to the 20th, through to the 22nd, to let them know that they can book their test. And importantly, obviously those people that were returned on the 17th or the 18th will have been, in the main, started their testing yesterday, I would think, and hopefully we'll be able to allow them to not have to abide by the stay-at-home order. Increased capacity is being established for both the public health hotline and testing facilities to ensure we're able to meet demand. Students will be able to return progressively to school following a negative test and completing the 14 days. This will enable most students to return to school very soon, bearing in mind that the 17th of July was the second last day of school holidays, and we expect that most students would have been returning back to the state then at the very latest, with school starting on what would have been Monday the 19th, or the week of the 19th. For those who are currently at home, there are 5 key reasons why you're permitted to leave home. These are to shop for necessary goods and services, obviously food, beverages, fuel, household supplies. You can leave to access medical or health treatment or supplies, including to be tested for COVID-19, but does not include leaving to attend a COVID-19 vaccination appointment. We would ask, if you have a COVID-19 vaccination appointment, that you contact the public health hotline or through the email, and ensure that you seek a new date for that. So in terms of access to medical or health treatment, you can leave for a COVID-19 test, but not for a vaccination. You can leave home if you attend work or school if unable to be undertaken at home, or you can attend work or school if unable to be undertaken at home. Noting that in terms of students, the government has determined that students and school staff have been asked to stay home until they are cleared to return. And so, again, that's the 14 days and a negative test. To undertake personal exercise, you can leave home, but exercise must be undertaken with a person from your household, including carers or with someone for safety reasons, as was explained on the weekend. But all exercise activities must be conducted within a 5-kilometre radius of the household. You can also leave your home if you're under the stay-at-home order or accommodation if you are going to leave Tasmania, and that could be to return to another state, if not Queensland. No matter what the reasons for being out of the home, masks must be worn until exempted, and while you're at home you must not have visitors. Information is being provided to impacted people, as I said, via SMS, as is the standard practice, and I've spoken to a number of people that have been caught up in this, and they've indicated to me that the communication has been very good in terms of letting them know what their circumstances are. However, if you have any queries, do not hesitate to call the Public Health Hotline on 1800 671 738. And just as I've said on every other update, please keep on top of COVID. Please protect yourselves and your family. Follow the COVID-safe behaviours. Make sure that if you're not under a stay-at-home order and that you are out and about, that you use the check-in TAS app, that you follow good hygiene practices, stay home if you're unwell, and importantly, even if you have the mildest of symptoms, ensure that you get a test. I'll hand over to Dr. Beach.
Thank you, Premier. Good afternoon. I'd like to first acknowledge the work that many colleagues in health and public health, in the control centre and other agencies did over the weekend to set in place these measures to protect Tasmanians. Queensland is currently facing an outbreak of the Delta strain of coronavirus, which is one of the reasons why we're taking a precautionary approach. We know from the experience of Sydney how the risks that the Delta strain does pose to large cities, but we also know from the experience of places such as Melbourne that with prompt action it can be controlled, and we certainly hope that transpires for Queensland. But here, we're in the business of trying to prevent it from getting a foothold if there's a person in Tasmania with the infection. Queensland has seen on successive days 1 case, 6 cases, 9 cases and 13 cases related to this outbreak. The good news is that all of those cases so far have links back one to the other, but there are still some unknowns. For example, how the 2 people from overseas gave rise to an infection in the high school student in Brisbane. That's not understood, and there's some concern that there's a possibility of cases of coronavirus undetected in the community that could be posing a risk. Our concern is that there could be people who have come to Tasmania, particularly in the last 2 weeks of July, who could pose a risk by being unaware of the circumstances that they are in South East Queensland, where there may have been a case. And that's the reason why we put in place the stay-at-home requirement for people who've come out of South East Queensland to Tasmania since the 17th of July. We're aiming to address the risk to Tasmania that 1 or more people in there may pose. The idea of a stay-at-home order is not entirely unfamiliar to Tasmanians. We used a similar sort of process early on in the pandemic last year for some weeks at end. In this case, we're applying it to a very specific cohort of people who've come to Tasmania recently from Queensland. It is, in essence, a very similar approach to what Queensland's applying and what a number of other states, New South Wales and the ACT in particular, are applying to people who've come to their jurisdictions from Queensland. And the aim is to balance protection of Tasmanians against the restriction of people's movement and activity. People will remain subject, as the Premier outlined, to the stay-at-home direction until 14 days after they've left South East Queensland and they've received a negative test result from a test done at least 12 days after leaving Queensland. And that gives us some assurance that at the end of those 14 days they're not currently infected. Of course, anybody who's subject to a stay-at-home order who gets symptoms at any stage, we want to go and get tested immediately. So I might just leave it there, pass over to Catherine Morgan-Wicks, and can come back later for questions.
Thank you very much, Dr. Veitch. I'll just provide this afternoon a quick update on the Tasmanian vaccination rollout and testing. So we've had another record week with over 25,000 doses delivered in Tasmania, taking us to a total of over 323,000 doses delivered so far. Over 24.7% of eligible Tasmanians are now fully vaccinated, and over 48% have received one dose. Last Saturday, Tasmania opened up for the 30 to 39 age group, and I'm pleased to say that we have had close to 10,000 bookings for this age group in coming weeks, with over 26% of the 63,000 Tasmanians falling into this cohort already vaccinated. Now today, if I can make a call out for help from our enrolled nurses in Tasmania. If you are an APRA registered enrolled nurse who would like additional hours, please contact the Department of Health. At a minimum, we'll ask you to work at least one 8-hour shift per week at our vaccination clinics, and if you have more availability, we will take it. The vaccination rollout is one of the largest health logistical exercises in our country's history. Please, if you can, if you're an enrolled nurse that is APRA registered, please join us in this mission. And to finalise on testing, we have had over 1,300 presentations today, with some 250 already booked in for tomorrow. We are operating at each of our testing sites with extended hours and surging to deal with what is the current situation that we are facing, an escalation level in Tasmania from the Queensland situation. So I can open if there's any questions on testing or vax.
Just quickly with the enrolled nurses, I think you've already done a call out for registered nurses. What's the difference there?
So we've got already some 250 registered nurses that are already participating in our vaccination clinics. We have also extended authorisation through to our pharmacists, for example, and now enrolled nurses, and enrolled nurses being at a different level of training. So, you know, working our way back down to try and expand our vaccination effort.
Has South East Queensland or Queensland in general requested any of our vaccines at all to deal with the situation up there?
So as State Health Commander, I haven't had a request from Queensland in relation to sharing a vaccine.
I had a report from a reader of difficulty getting a booking for a first dose of the vaccine at Kingston. Are there any difficulties, and what's the message for people who are not able to get a booking for the first dose at one of the clinics?
So our state vaccination clinic at Kingston is actually running dose 2 clinics at the moment. We've got some 80,000 Tasmanians that are still receiving their dose 2 of AstraZeneca. However, we have dose 1 clinics that are available online, so it just might not be at Kingston, and we've got over 105 GPs that are offering AstraZeneca, as well as 26 of them also offering Pfizer, and we're going to be introducing pharmacists to the effort in coming weeks.
When do the pharmacists, or when do those pharmacies that you talked about last month, when do they come online?
In about a week's time, so we can say more at the end of this week about their starting date. The Commonwealth, from reports that we've had over the weekend, have onboarded close to 500 pharmacists, for example, in New South Wales to assist with their effort, and we've just been pushed a little bit back in the queue, but we'll have some 26 pharmacists joining in 2 stages through August.
Questions for Dr. Veitch? Can you just elaborate on the rules for school children and staff? So there's no set date that they would be able to return. It's each individual person who's been in Queensland would need to go through that isolation period and negative test.
The isolation period, or the clock starts ticking when you leave South East Queensland. So we figure that most of the people who are currently in Tasmania, who are either school teachers or school children, will have come back from South East Queensland towards the end of that week that finished on the around the 15th? 17th. And that's now more than 2 weeks away. So for those people, and that's almost all students and almost all teachers, We want them to remain under the stay-at-home order until such time as they get their tests. So they're the people we're really encouraging with the SMS that they'll have all got yesterday and today to go get their test. When they get that negative result in hand, they can go back to all of their activities.
Dr. Beach, over the weekend we've seen the announcement of several fairly significant food and music festivals. How much of the Tasmanian population do you expect we need to have vaccinated before we can look at easing restrictions on crowds and dancing, and when do you expect that to happen by?
Look, that's a question. It's over the last couple of days, with the concerns about New South Wales, the concerns about Queensland, I and my colleagues have been turning our mind very much to the risk that's posed to us. That question is an entirely reasonable question about when we're ready to get out and get back to normal. But I'll have to admit it's caught me slightly offhand, and I'm just not in a position to give you a precise answer. I think it's likely to be considerably later this year, at the very earliest, that we would consider a very liberal approach to gatherings. And I think between now and the end of the year, we really have to be cautious. What's happened is the Delta strain's got around. It's twice as infectious as the strain of coronavirus that we were dealing with this time last year. It gets away really quickly. So at the moment, I think the thing for people who are getting out and about, enjoying activities, is to understand that there will remain limits. We want you to remain cautious, never go out when you're sick, follow good hand hygiene, wear masks when we require it for particular events. We'll get through that, and then we'll get to the point when, with a substantially vaccinated population and a lower level of risk, we may be able to look forward to heading in the direction of what we used to in those events. But
how likely is it that Delta will arrive on our shores?
I think that when a case of coronavirus occurs in Tasmania, it's almost certain to be Delta.
Just one other thing I want to clarify. With the rules that people who are in home quarantine, they're allowed to leave for medical treatment, they're allowed to leave to get a test. Are they allowed to leave to get vaccinated?
We're currently talking about stay-at-home orders,
Yes.
which is the order that applies to people who have come out of South East Queensland. It's a specific direction related to those people. And those people will be able to rebook their vaccine if they've got one currently booked after they've completed their 14 days and got their negative test on or after day 12.
That's not one of the reasons they can currently.
People who we think are at some risk, we really don't want going to a vaccination centre. There's a couple of jurisdictions that have had people, infectious cases turn up to vaccination centres, and that's disruptive.
Can I just ask, sorry, about the 5 people that have been cautioned for stay-at-home breaches, 4 of those people returning from Queensland and attempting to enter Cradle Mountain National Park. How disappointing is it to see people, failing to comply with these stay-at-home orders?
And we have stay-at-home orders to protect people, whether they're moving around Salamanca or whether they're in the remote parts of the state. So it is disappointing, and we want to make sure that people over the next, it's only going to be a week or so till we're on the other side of this, I hope, and it is disappointing. Yes.
Is Tasmania providing contact tracing support to New South Wales or Queensland, or has that been requested?
We are, along with a couple of other jurisdictions, providing some support for case interviews for New South Wales. We make a modest contribution, but we're very pleased to do it. Clearly, the demand on Queensland with those number of cases is not great at this stage, and they're managing that very well themselves.
Sorry, just one more for Dr. Beach. There were 2 AFL games played over the weekend with crowds of up to 10,000 people with masks required. Could you just elaborate on what the current restrictions are for other types of events with the crowd restrictions if masks are worn?
The direction that I put in place for the games at Blundstone and UTAS Arena applied to larger events, the sort of events that have require the director's approval. But we knew that they the only current events that were currently slated to occur were those 2 football games, and I think they gathered a total of about 6,000 or 7,000 between the 2 games, so they got not particularly close to 10,000. it is likely that what we're doing at the moment is reviewing the events that are currently scheduled for the coming weeks, and I think it's likely that we will retain in place requirements for mask wearing at larger events, and we just need to land on how large and the categories of events. But I think people can expect that for larger activities, and particularly free mixing activities, they'll be required to wear masks at them for the foreseeable future. We have to put that measure in place. We know that mask wearing reduces the chance of transmission by 20 or 30%, and that's a useful edge to have against something that's as transmissible as the Delta strain.
Just on that, are you considering increasing the crowd limits for the AFL game that's scheduled for the weekend?
I wouldn't recommend that, no. I think we made relatively clear late last week that we'd look carefully at the risk, and the risk that a game of that size might pose to Tasmania. If there was a case amongst a very large number of people, it would spread risk all across the state. So we think that 10,000 is a reasonable limit to fill the stadium in the seated area and also leave a little bit of space left over.
So with the way things are going at the moment, what would you say we could expect? Say, I mean, there's been discussions of a music festival potentially being held at Dunstan Arena up here. 6 months' time from now, what could we expect if things keep going the same way in terms of...
No crystal balls from gazing from me. I kind of understand that people really want to know what things are going to look like in 6 months' time. I don't know what they'll look like in 6 months' time. I hope they're better than they are now, but if you'd asked me what things look like now 6 months ago, I would have given you the wrong answer.
Any questions for the Premier? Thank you.
Thanks, Dr. Veitch.
Premier, is it appropriate that the 5 people who were participating in stay-at-home orders were cautioned rather than fined? Is this to be a deterrent? Should they have been given a fine instead?
Well, to be frank, they had obviously breached. They've been cautioned. Now, that's an operational matter for the police. I understand, though, that there have been a number of other reports of people that haven't been abiding by the stay-at-home order, and they may not be so lucky. In fact, there's a $774 on-the-spot fine. I know the police will be going about their business following those up as well. But again, it's an operational matter for police.
What would be your message to anyone who should be staying at home under those orders but maybe is considering breaching that order?
Well, the reason that we're asking you to stay at home is so that you can keep our community safe. And to be frank, I'm very disappointed that people would breach that order.
Given how serious the situation is, though, with the Delta variant, I mean, would you be encouraging police to take a more heavy-handed approach?
Well, I think, let's see, at the moment we've had 5 cautions issued, and that's not to say that the police won't start to issue fines from this point onwards. But again, it surprised me that we'd have 5 people that would so blatantly disregard an order that's put in place to keep our community safe. And I would just say to people, at the end of the day, don't be an idiot. Do the right thing. The reason we're doing this is so that we can keep you safe, your family safe, and importantly, our community safe.
Is there a degree of complacency creeping in? We're leading a fairly normal life here in Tasmania. We've had a pretty charmed run. Are we a little bit too relaxed given the level of threat with this Delta strain?
One of the things that we have had is the benefit, obviously, of a long run without any COVID being identified in the state. In the main, I think the way that we've seen people now adopt the Check-in Tas app, the way that I saw people behave on the weekend at the Blunston Arena game, where I was more than pleasantly surprised by the way that people engaged and wore masks. In fact, in the main, those that I saw were doing the right thing, and in fact lining up to get into the game and having the opportunity to speak to a number of Tasmanians from around the state who were very comfortable in taking that step to wear a mask and to do the right thing and to ensure that they socially distance while they lined up as well. So that gives me heart, but at the end of the day, the point I made on Saturday is that this isn't a drill. Delta is different. This strain has shut down New South Wales, and it might be shut down for months to come. We've just seen an extension in Queensland of a local lockdown again. This is particularly concerning. This is serious, and people need to ensure that they do the right thing.
Premier, do we have any current numbers of the check-in Tas uptake as of today?
Look, I think at the moment it's around 31,000 businesses that have actually signed up to it. In terms of the volume through, I don't have that number to hand.
So over 18 million today.
18 million check-ins to date.
And do we know what percentage of Tasmanian businesses that 31,000 is?
Well, again, not every business needs to utilise the check-in tabs up, only those that are captured by the direction. My understanding is that compliance is very high at this stage.
Tasmania is part of a working group with Victoria and the Northern Territory to look at developing special rules for people who've been vaccinated, differential restrictions. What is that work going to involve from Tasmania's point of view?
Well, obviously, I have a very keen interest in keeping Tasmanians safe. And so I was very pleased to put my hand up and be a part of this on behalf of the state. Look, obviously, there needs to be benefits from being vaccinated. And at the end of the day, I think whilst there will be some challenging issues that we'll need to work through, because we're talking about people's personal freedoms and liberties, at the end of the day, I love my family more than I do my freedom. And so that's the mindset that I'll be taking into this. And as we work through, I would hope that we could see where there are lockdowns in other states, for example, that there may be ease of travel for people if they have been fully vaccinated. But these matters are all things that we will discuss as we work our way through.
I've just got a non-COVID question.
I've just got a few more COVID sort of ones,
No.
if that's okay.
More important.
No, it's okay, I'll just get through these quickly. Yeah, I'll be quick with these. This will be a short answer. The police advised you why the people who were caught breaching the stay-at-home orders were cautioned rather than fined?
No, and as I've said, that's an operational matter and I leave those judgments to the police.
Yep, and have you given an answer to Jeff Kennett about his call to allow more people to go to the Commonwealth Horse game?
Look, I think we've just heard the answer from Dr Veach. Look, I won't do anything, as was noted by Jeff Kennett. I'll take public health advice on these matters, and a crowd of 10,000 is what is viewed as being safe. I would think that if we were able to have no restrictions at that game, that we would see a stadium that would be swinging from the rafters. But we're not in that position. What we're doing is ensuring that we keep people safe, and public health have made the rules perfectly clear.
What's your message to the AFL Commission who will be receiving the CAR report later this week?
Well, I've had a number of discussions with Gil McLachlan in recent weeks. My expectation is that report will be provided to the state and also made available publicly shortly. It would be my view that sitting on that report would only lead to further speculation. And as I've very clearly indicated to Mr McLachlan earlier this year, I want to see that report and understand what's in it before we finalise contracts to roll over the current contracts with Hawthorn or North Melbourne. And so my view would be that I'd like to see it as quickly as possible after the Commission have looked at it. Then obviously we will, the Presidents and the Commission will make a decision later this year, but I think the Carter report will give a clear direction, at least that's what I'm hoping, in terms of the direction forward.
Thanks, Paul.